Hello, my name is Melchizedek Leo, and we'll be discussing maternal health in New York City, a deep dive into the holistic factors enabling poor outcomes in the area. This report is beneficial for both New York City's network of public hospitals, as well as hospitals across the nation. New York City is home to residents from diverse walks of life. Therefore, the work done and progressed here may serve as a vanguard in which the international community can learn from as a result of potentially improved maternal health outcomes. Sociopolitically, maternal health has been gaining a lot of capital lately. It's been a very contentious topic. It's been in the forefront of healthcare. But similarly to other social issues such as unemployment, income inequality, and healthcare overall, we found that African American women statistically bears the worst of these outcomes. And you can see how the trend and the legacy of slavery still persists in our institutions today. So it's important to note that. So let's look at the numbers. In the US, rates of mortality for African American women resembles that of low-income countries at 42 pregnancy-related deaths per 100,000 live births. Adversely, rates for white women resembles that of high-income countries at 12.4 deaths per 100,000 live births. These statistics mirror a flagrant disparity. Remember, maternal health is a moral and humanitarian imperative, but the U.S. are failing Black mothers. They traverse the valley of death to bring their babies to term. So below is the systems map, and it basically illustrates the interconnection, the whole ecosystem of maternal health in New York City. And if you want, you could take a moment and pause the video to see how you interpret things. It basically draws out equitable recommendations that will benefit mothers across varying socioeconomic classes. For it is widely known that this epidemic plagues women from high socioeconomic class and low alike. As you can see, there are a lot of factors corresponding with each other. There's a lot of moving elements. But in an effort to simplify these comprehensive circumferential findings, I concluded that the ensemble of these ingredients evolve around accountability, communication, and political will. With standardization and proper oversight, maternal outcomes can in fact improve. It can. But this will require increased accountability in this non-punitive healthcare system. It's rare for a doctor to face consequences for malpractice, but that has to stop. With greater dialogue taking place on this matter, we can shift the way politics address the situation. Also, stronger political will would yield policies such that greater resources could be generated to these matters, especially in low-income or low-resource communities, ensuring equity since birth. These are the widespread elements that would engender a multifaceted impact. However, the individual level, the patient-provider level interaction is equally important. Comprehensive and skilled communication is crucial for improving these outcomes. This may come in forms of informed consent trainings and cultural competency trainings and understanding language barrier. Finally, involving the patient in the plan of care and adhering to the patient needs and their level of pain is important in the communication process. These facets in maternal care, which informs this wide racial disparity, sheds light for the healthcare infrastructure to listen and act swiftly and accordingly.